Alright, I'm doing some investigation about Planned Parenthood and Senate Bill 275. I got an email from the Family Foundation.
Thank you for calling Planned Parenthood.
We're going to see what if Kentucky has to say about this, you know.
To help us connect you to the Planned Parenthood Center in your area, please enter a 5-digit zip code for the area you are interested in. Please enter your zip code now.
So they want their zip code.
Please hold and you will be transferred to the Planned Parenthood Center nearest you.
Here we go. House Bill 75. And here is the Family Foundation saying yesterday's weather. This is an email from them about, calling in. So I'm going to call Planned Parenthood on Senate Bill 71.
Now schedule most appointments online. Please visit us at www.plannedparenthood.org and schedule at the center of your choice.
Okay.
www.plannedparenthood.org.
So this is Senate Bill.
Your call will be answered in approximately 1 minute.
Senate Bill 71. And my representative is Myron Dossett.
Thank you for calling Planned Parenthood. How may I help you?
Yes, I'm calling in. I'm from Kentucky, and I'm calling in about Senate Bill 71. And I've been told that Planned Parenthood is trying to bring a different kind of education, and I'm wondering if you can give me any input about actually what the bill is, or can you refer me to someone about it? It's Senate Bill. Go ahead.
I was going to try to find someone that could assist you with that, because I personally don't know too much about it right now.
Okay.
But if you could give me a moment, I could definitely get you on the line.
All right. I would like to know, because I'm recording this because I'm tired of getting misinformation. So I want someone that really knows what they're talking about, because I'm gonna respond to this appropriately. They're asking me to vote yes or no, or tell my senator and my representative as if they're going to follow me or vote like I want them to. So it's an alert coming out here from the Family Foundation. Personally, and I would like to talk to someone if possible.
Okay, and it's what bill is it?
Senate Bill 71. This came out January the 17th, so it may have already passed. I don't know what the status is on it.
Okay. All right. Give me 1 second, okay?
Sure. Find out their location. Today is the 22nd, and I'm checking my email. 22nd of January 2018 is today's date. And this is how you do grassroots lobbying. This is Americanism here. You're looking into something. Personally, sex education is very important to me, because I was chastised in a church meeting once for using the word infertility as though it was evil or inappropriate among adults. So I don't know who's going to come on here, if anybody's going to come on here. But we're going to find out, because we're going to dig a little deeper. And that's the way I am. I call. Now this email actually came out on the 17th, and today is the 22nd. So that's 6 days ago. So it may have already been passed. But in Kentucky, we also have what's called the status line. And you call 1-800.
Can I help you?
Yeah, my name's David Fletcher, and I'm calling about Senate Bill 71. Do you happen to know what the status is on that? Because I got an alert from the Family Foundation telling me that, the bill should, be of concern. I didn't know if you guys are up to speed on it or not, but you're actually named in this email. You may or may not know it.
Let's see. Sure. And this is the switchboard at our administrative office, so let's see, so you're calling about a bill, so I'm going to want to go ahead and connect you over to our advocacy department. Let me put you on hold and see if they're available.
Yeah.
I have a question regarding Senate Bill 71.
Right. Yeah, I need to talk to someone that really knows what's going on in the Senate and the current legislative session.
Okay, hold on just one moment. Let me see if they're available.
Okay, so we're going to be transferred to the advocacy. Okay. Find out about the advocacy. 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 Middle and East Tennessee.
No matter what, we are your resource for reproductive and sexual health care and information.
Reproductive and sexual health care.
Hi, sorry about that. So, looks like a lot of folks in the advocacy department are actually not in the office today because we just had an all-day event on Saturday, so I think they're not in today. But what I could do is give you the email of of the person who you can ask the question to, and then she can respond back to you as soon as she can.
An email address?
Yeah, would you like to email her?
Yeah, I mean, but I'm
But she may not be able to respond as quickly.
okay, thank you.
Do you have a pen and paper handy?
Yes, I do.
Her email is Lizzy.
Lizzy.
So it's Lizzy.
Okay.
So it's Lizzyt as in Thomas.
Okay. All lowercase?
At, yeah.
Okay.
At ppnet.org.
Okay, PP.
Paul.
Say again.
So it's Paul, Mary, Edward, Ted.
Paul, Mary, Edward,
Ted.
Ted. TED. So I got PPMETED.
Paul, Mary, Edward, T as in Thomas. Yeah.
Okay, it's PPMETED, correct? All right, and what is her name?
It's just ppmet.org.
Okay, PPMET .org, and that's the email address? Okay.
Yeah, her name is Lizzy Thomas.
Lizzy, Lizz, Thomas, TOMAS. Okay, well, I've got an email here. It's a couple of days old, so they're going to be voting on this really quickly if they haven't already. I'm getting ready to call the status line.
If you want to forward that email to her so she can take a look at it, I'm sure she'd appreciate the intel.
The information?
Yeah, I'm sure she'd appreciate it.
All right.
If you just forward.
Well, have her give me a call. You know, I mean, I'm willing, ready, and able right now to talk to anyone about the bill, but transmitting something to somebody before I have a talk with them, you know, because I'm more of a verbal learner. That's kind of the point of this. I was calling in to see who's on staff and how you work. Now, where are you located at as we speak?
Nashville.
Okay, because I'm calling about a bill in Kentucky.
Kentucky, okay. Yeah, got it.
Well, I mean, I put in the zip code for my home in Kentucky. Which, you know, I put that zip code in, so I don't know how I got Nashville.
Got it. Okay. So what I think that you should do is there is an affiliate in Kentucky called Planned Parenthood of Indiana and Kentucky.
Okay.
So I think it might make more sense for you to get in touch with them, because I know that, like,
Do you have a phone number?
for tracking legislation. Yeah, let me pull that up right now for you. Hold on just one moment.
Okay. So you're in Nashville.
Yeah, we're in Nashville. Sorry about that. Yeah, let me... Sorry, just one moment. Oh, okay.
Beep. Well, I'm just wondering. Well, I can read this to you. It says abstinence-based education ensures that if sex ed is taught in a Kentucky public school, abstinence would be presented as part of the curriculum. Across the country, Planned Parenthood and other liberal groups have formed coalition to replace all abstinence-based curriculum with comprehensive sex ed. So-called comprehensive sex ed normalizes premarital sex and LGBT activity at very early ages. These efforts have now come to Kentucky. Senate Bill 71 will ensure that should a school district authorize sex ed, abstinence will be marriage is still presented as the only guarantee against pregnancy and against contracting sexually transmitted disease. So I mean, I don't know if that is your position, what I just read there.
It is not, and I just answered the phone here at the facility. I'm sorry about that. So what I can do is give you the number of the person who works with Planned Parenthood in Indiana and Kentucky, and they are going to be the ones who you'll want to talk to because they'll have more information for you.
Yeah. Would you mind giving us your name?
Oh, sure. Elise, E-L-I-S-E.
L-E-I-S-E? Elise? Okay. And you're in Nashville. Well, the reason I'm asking, what someone says, you believe. The most important to me, I'm 64 years old, and forgive me for saying this, but penis and vagina and reproductive things like that, at a very early age, I don't know when you start teaching that or what you advocate, but I don't know. What do you think is appropriate?
Well, I am not qualified to be able to answer a question like that. I'm sorry.
Okay.
What I can do is give you the number of the person who works with Becky and have more information about the specifics of the bill, and I'm sure they can answer your questions for you.
Okay.
If you have a pen and paper handy, I can give you that number.
I am writing it down and I'm recording this. Go ahead.
It is 502.
Okay, 502. Proceed.
400.
400.
Yeah.
Okay, that's 502 400, and the rest is
2310.
2310. Thank you for being, and that's Planned Parenthood of Kentucky and Indiana.
Planned Parenthood of Indiana and Kentucky.
So it's probably, the states are so small, you have two groups. The reason I'm concerned is that I don't know what you teach, and I know what someone is saying here, but you said, about what I read, what did you think or perceive was not taught by you?
I'm sorry, I would not be able to answer the question. I'm really sorry about that. I'm really just answering the phones here, and it's my job to connect you with the person who can best answer your questions. I'm sorry about that.
Okay, so you're referring me to someone else. Okay, I will call them and we'll proceed. Thank you. All right, we're going to call them. She didn't know. Maybe she's not a parent, or maybe she's never gone to school, or she doesn't have any opinion, or I don't know. We're calling Planned Parenthood of Kentucky and Tennessee and Indiana. Probably nobody there either.
Hello, this is Mari.
Murray? Marie?
Mari.
Mari?
Mari.
Good morning, or I guess it's good afternoon. It's 3 o'clock. I have an email from the Family Foundation, and they've sent out an email about Senate Bill 71 that's in the Senate. I don't know what the status is right now, and I'm wondering if you guys have any insight on that bill or what that bill represents.
Yeah, who am I talking to?
My name's David Fletcher. I'm just a citizen, that is all. But I got this email that says abstinence-based education ensures that if sex ed is taught in a Kentucky public school, abstinence will be presented as a part of the curriculum. Across the country, Planned Parenthood and other liberal groups have formed coalitions to replace all abstinence-based curriculum with comprehensive sex ed, so-called comprehensive sex ed, normalizes premarital sex and LGBT activity at very early ages. These efforts have now come to Kentucky. Senate Bill 71 will ensure that should a school district authorize sex ed, abstinence until marriage is still presented as the only guarantee against pregnancy and against contracting sexually transmitted disease.
Yes. So we have been following Senate Bill 71. We are not against abstinence one bit. We believe that abstinence is the only way to prevent sexually transmitted diseases and prevent an unplanned pregnancy. However, the problem that we find with Senate Bill 71 is the language itself in the bill. So it does say that abstinence before marriage is the expected standard. And the way that it's written, it can be read to say, to believe that if you wait until marriage, then you're protected against STDs and unplanned pregnancy. What we want in the bill is just comprehensive sex education. Abstinence needs to be the focal point, but there needs to be conversations around consent, healthy relationships, how to protect yourselves from an unplanned pregnancy or sexually transmitted diseases. And that's not in the bill. So there is no statewide legislation that would mandate that there is comprehensive sex education. This bill then could be read to by different school districts that it's an abstinence-only education. Planned Parenthood and the ACLU are advocating that the bill be expanded to include comprehensive sex education and to take out some shameful language. Kentucky has one of the highest teen pregnancy rates in the nation. We're 7th highest in the country. When you say that abstinence is the expected standard until marriage, it shames the teen parents. It shames families who don't come from a married household. Taking out specific language but still having abstinence as the focal point is what we are advocating for.
Okay. Well, the only thing, you don't see what I'm reading here, but, you know...
I can guess, though.
Well, it's from the Family Foundation. And quite frankly, I don't trust anybody that sends out an email because it's propaganda from both sides. And they're not going to listen to me. You know, I don't even know where that bill is in status. Do you?
So, actually, we were just watching it today. So it's in the Senate. It passed out of the Senate Education Committee. There were 2 no votes, 1 Republican, 1 Democrat, and 1 abstained. There are now 2 amendments to the bill. So one that would broaden the language so that teaching abstinence is the focal point, but also having conversations about healthy relationships, consent, contraception, that is included. There's also a second amendment to make sure that in elementary school, this is filed by a Republican, that there is conversations about good touch, bad touch, and so that kids who are being abused can report to their teachers, that they would understand if they were being abused at home.
I understand what you're telling me. So the bill has been amended to meet your satisfaction.
Yes, I think so. I would hope so, and I'd hope that the Family Foundation would agree that it's good amendments. They haven't been voted on, so we're still waiting on the amendments to be voted on and a discussion on the Senate floor. And then what would happen is the bill would move over to the House in Kentucky and kind of start the process all over again. So we are advocating for people who support a full spectrum of conversation around sexual health to call your legislators, call your senator, call your representative, and let them know that you would like to see the conversation, to include, healthy relationship, consent, good touch, bad touch, as well.
Yeah, I guess the only thing that really triggered me, because I pretty much understand, is that sexual activity taught at very early ages. At what age do you explore sexual activity with a child or adolescent?
Yeah, so right now in Planned Parenthood, we advocate talking about sexual activity, not exploring, but talking about sexual activity, at least in a middle school frame. So talking about abstaining, talking about consent, within the middle school through high school, so like 7th through 12th grade. Now, the good touch, bad touch that Senator Kerr attached, that would be in elementary school. It's not talking about exploring your sexuality. It's trying to help students who are being abused at home understand maybe that they're being touched inappropriately. So it's a good touch, bad touch, and nothing else. And we do support that.
Okay. Well, I was just wondering, where you were on the bill, and because it's still.
It's a spin, but we definitely are huge proponents of abstinence. That's the only way. But we want the conversation to be more broad, and so that people don't think, too, when they get to marriage that they're safe. That you still have to have conversations about consent and, understanding how the body works. If you want to plan your pregnancies, if you want to make sure that your spouse hasn't already come into the marriage with an STD, they're just bigger conversations that need to still be happening. But those conversations, I think, we propose to put forward in the high school, for the high school ages.
And I understand that. Well, you've said a lot. I don't know if I can comprehend it all, but I'm going to call the status line and see where it is on this. So you support Senate Bill 71 as it is now, as it is amended?
With the amendments, correct. We do. With the amendments, we support it.
Okay. Sounds like I would support it too with the amendments.
No, it's a great bill with the amendments now. What I'm afraid of is that it'll get mired in the culture wars, unfortunately. But it's a really good bill right now with the amendments.
What do you mean by culture wars?
So, like, you got the email from the Family Foundation, saying that Planned Parenthood is against abstinence, or that we don't support the bill. So I feel like sometimes they use that as a distraction to put people away from the actual bill, and to it can be considered like a culture war.
Yeah, I get that. Well, this email is dated January 17th. I'm just going through my emails, but I've never contacted Planned Parenthood in my life, and don't know anything about Planned Parenthood. But anything about human sexuality, I'm a little bit concerned about it, because my wife and I are not able to have children, and Southern Baptists aren't really in favor of surrogacy, donor sperm, donor eggs, IVF. The Catholics are against that. And if you have a discussion at a high school level about reproduction, you're going to bring those into the conversation. If you're at a modern high school, do you understand what I'm saying, or where I'm coming from?
I think so, yeah. Students, and that's the thing that we see with, educators and stuff. Children are asking so many questions. They're very curious. And when you do have sex education classes, there are going to be lots of conversations brought up. We just ask that it's medically accurate and age appropriate.
Yeah, and figuring out what's age appropriate, that probably leads into the culture war, doesn't it?
Yeah, it does.
Well, my senator is Whitney Chesterfield. He's the head of the Judiciary Committee, former prosecutor. And Myron Dossett, I don't know what his background is, but I know they're both Christians. Mr. Westerfield's a Southern Baptist, and I don't know what Myron Dossett is. But they're not going to, I'm going to tell them, yes, I'm in favor of this, kind of based on what you're saying, and there's been some changes to it. But what I'm in favor of, because of my background, is that depending upon the age and the circumstances, that they do delve into how the body works, and consent is important. But when you get into high school, there are TV programs now that kids are watching that they're dealing about infertility and surrogacy and IVF and AIDS and all kinds of things that unless you don't have a TV, they're going to be exposed to it, you know?
Yeah, and it's going to be to their benefit if they have teachers who can actually teach them the facts, you know, and not just learn from the TV or the computer.
Well, I think I would agree with that. I'm kind of cautious to speaking with you because I'm not sure. You're probably better educated than I am.
No, don't ever feel that way. We're here as an advocacy arm, and so we do lots of education, and I'm just really happy that you took the time to call us today. And if you'd like, I could send you some information on the bill.
Sure. Well, I'm kind of, you're interested in reproductive rights. I'm real active in the surrogacy community. I have contacts in California, and West Virginia just voted where the surrogates could be compensated. Now that's a reproductive issue for infertile couples. Do you think that's something that Planned Parenthood would ever visit? Because people are planning to be parents who are infertile and they're seeking to use donor sperm or donor eggs or IVF or...
So, yeah, that is part of what we already do. When people come to us and they're looking to plan a pregnancy, while here at our health center, we're not equipped to see them through that process, we work with lots of local doctors to get them into the right care, especially if they're needing help with IVF, if they're looking for adoption, if they're looking for surrogacy. We are sometimes the frontline base that gets them connected to the...
So you actually are not opposed to surrogacy?
I don't know our specific stance, but I don't see why not, as long as that it's done ethically and the surrogate is compensated and treated with respect.
Well, I would challenge you because my resource on that is an agency's out of California, and the bill that they're trying to get passed there is very comprehensive, and it has, if I'm correct, the backing of the American Fertility Association, and they've had surrogates speaking in to the legislatures and committee.
Been against it?
The surrogates are for it because a lot of times the only way they can do that is if they're not compensated. And it's my understanding, and I've had different ideas on this, that surrogacy is illegal in New York, but then I get told no, it's not. But you're old enough and probably done enough life, you realize that there are mothers or even sisters or extended family that that do surrogacy because they realize that infertility is a disease, and it has the same emotional consequences as cancer on a couple.
And I can attest to that. I have severe endometriosis and cannot have children.
Yeah. Now you do realize we're being recorded.
I do not.
We are. We're being recorded because I get a little fed up with being told one perspective, and I'm very familiar with endometriosis. My wife had that. She is now gone, and she died with cancer, but that was many years ago. And so what I'm getting ready to say is a lot of couples, because I studied for the ministry, but a lot of couples who are trying to conceive, sexuality becomes a real, it's not a pleasure, it's a job. And they try really hard to conceive. So that's the reason why I'm interested in it, because when you talk about covering the full spectrum of human sexuality,